You're not a therapist now, you're a mother.
Yeah.
So what kind of mother were you?
Oh, God. Well, the best I knew how to be. The system was extremely dysfunctional, the one I came from, the one I created.
You created it? You created that?
Well, I mean, no.
Well, yeah, I'm just thinking. Surrounded by so many perfect mothers in the world, you must have felt a bit deficient.
Well, she certainly was glad to have me there. She told me so many times, thank you so much for being extremely stressful, and that by then she was with her dad, my ex, and the environment was so hostile that I stayed in the hospital. I didn't go back and forth when she went home.
So you had to put up with him as well as try and help her.
Well, certainly everybody knew that they couldn't piss me off, because if it did, I well understood I didn't have to be there.
Was
because
getting
I
divorced from him a good thing for you?
Yes.
Okay.
Yes, I think that I'd be dead. And see, that's what's concerning me, is that she didn't step out of the system. If I'd stayed in the system, I'd be dead. I think. I can't prove that, but...
Well, how's your life right now?
I think when I go home from this, I will be able to pull some things together that I've not been able to.
You mean you've been just existing up until now?
Well, I'm fairly much happy with my life. My enthusiasm for my work, though, left. And if I can't heal myself, if I can't heal my children, then,
Well, you could probably heal a few clients.
Well, yeah, I think I've done that.
They'd be so grateful. But I don't think that's what you really wanted to do. I think you wanted to help your children.
Oh, I did. That was my motivation.
Yep.
All right.
I hate to say that you did. I might just give you false encouragement.
You what?
If I said that you did, I might be encouraging you falsely. I mean, I think you have such a strong belief that you weren't really good enough.
I'm sure.
And did Cindy have children? I think you told me she had 2 children. Cindy had 2 children? Yeah.
Cindy had 2 children. And one I've not seen since her death. Cindy was married twice, and she had a child by each marriage. So that dad took the daughter, and I've not seen her since then.
How long has Cindy been dead?
Since May 16th, 2001.
May the 16th.
2 years.
That was just
last May.
Yeah.
And I've seen my grandson once.
Once?
Since her death.
You've lost them as well. Keep breathing. You keep holding your breath. Keep breathing. That's it. In and out. Big one. That's it.
Strangely enough, somehow they seem to understand what few messages I can get.
Who is looking after you right now? Who's helping you? Who's looking after you?
Well, Kim helps a lot. Kim's very, very great with me. And,
Kim is, who's Kim?
Kim's my daughter over in the,
Ah,
over there.
Kim is here in the room. Kim is here with you here?
Yes.
Okay. All right.
And Stephen Campbell, where are you?
So,
And Blanche, my friend Blanche, and
yep.
surrogate daughter Lisa, and
Surrogate daughter.
Debbie.
I like that.
Kim's my surrogate daughter.
Yeah, all the fun, none of the responsibility. It's beautiful.
And Devin Myers, and
Yeah, okay. I was worried in case it might be like a cat or a rabbit or something. You have real people helping you.
I have real
Yeah.
people, really live people
Yeah.
helping me.
Good.
And so many of them are educated through my classes, my whatever that. They do a really fine job.
Oh yeah. How's that feeling in your chest right now?
Okay.
Well, you're okay, but is it there?
I'm relaxed.
Yeah. So, what if I said to you there was a part of you that wanted to live and to be here, and a part of you that didn't? What would you say?
Yeah.
Okay, rub this spot. Even though part of me wants to live, say that.
Even though part of me wants to leave.
Live.
Live.
Yeah, live.
Leave.
I like your version. Leave.
L-I-V-E.
Whatever. Part of me doesn't.
A part of me didn't.
Didn't. But
I think I can say that. Well, I'll go on. Okay. I'll follow the ropes.
well, I'm thinking part of you wants to be here and
And
live,
part of me doesn't.
and part of you doesn't. I mean,
Right.
do you agree?
That's certainly the way it was. I think that's changing, but go on.
Well, according to the natural order, I have an
Yeah,
idea.
how is Australia in June?
There's a natural order in these things. You're supposed to die first, okay?
Oh, I know that.
All right. So you're going to inflict this on your other two daughters.
Wait a minute, I'm supposed to go out of here first. And
You're supposed to die, to leave, to pass
Right.
over first,
I
okay?
know.
So you're going to inflict the suffering of that on your other two daughters.
I'm going to inflict that on my other two daughters.
Yes, because
Wow.
if everything happens in the natural order, you can go first.
I certainly hope they're smart enough to let me do that.
Well, I hope so too. But who knows what's going to happen?
No one. No one.
If only you knew how long you had left.
Do I know how long I have left?
If only you did know.
If
Then
only I knew how long I
then you
have
could
left,
relax.
then I could. Yeah, Kim, you were right about that. If only I knew how long I had left, I could relax. Yeah, I've been awfully.
And did you tell me you had some heart trouble?
Oh, yeah. That's been since '89 now.
Yeah. My cardiologist said to me, your heart will last you as long as you live.
I'll bet you're right about that.
Very unhelpful guy.
And no longer.
No.
Thank you very much.
Well, I haven't finished yet.
Oh.
I have a feeling that what happened has upset your idea of how things should be. But what would you say?
Well, it's not just my idea. I mean, the natural process of things is that the older die and the younger live. You know, I trained with Elizabeth in the 70s, so...
Elizabeth Kubler-Ross.
Uh-huh.
Is she still alive?
Last I knew she was, but she's asking to go out of here. But I don't know whether she's gone yet or not. I think she didn't get to call that shot yet.
Wow. Of all the people who deserve to arrange their own death, she would have to be number one. You trained with her? Right, so all this was perfectly acceptable to you. You understood the whole thing, didn't worry you at all.
Oh, I don't know what it would have done. I don't know how people do it without help.
Yeah.
It took everything I knew and everything I could hope to learn to make it. And
Just tap your little finger point.
it's like we got transferred to the IC. And I'm looking at this strange nurse that's not trained in the leukemia bone marrow transplant, and I'd say, do I call her dad? Do I call the family? What do I do?
Keep tapping.
Because the bone marrow transplant unit is still saying, don't let her see you cry. You just never say never. You never say die. And we're at IC, and I know for how many times have we been there, right up to the door of death and moved away from it.
Yeah.
And I looked at this nurse I didn't know, and I said, good God, what do I do? And she said, well, they don't do this kind of treatment unless it's the last resort. And, she and I both knew that it wasn't working. The last resort was that she wasn't going to make it. And so my training with Elizabeth, it was, you don't ever talk about, quote, death, you say, do you want to talk about it? It. And sometimes they'll say, my mouth is dry and my throat is scratchy. And Elizabeth asked an audience of 2,000 people, what did she just say? And the audience said, well, she said she didn't want to talk about death. And Elizabeth said, no, she said, my mouth is dry, my throat is scratchy. So I was standing there going, Jesus, God, Cindy needs to know. There's no doctor, no nurse, nobody. I've never felt so alone in my life.
You had to be you had to be the helper for her. You had to do everything for her.
Well, that decision was extremely difficult on a personal level, on a professional level, and on a spiritual level.
Why on a spiritual level?
Again, it's her journey. It's her transition. My stuff shouldn't get involved in it. My needs should not be there.
Yeah, you're just the mother.
Well, my need was that I thought she needed to know, and if it had been me, I would have wanted to know. And so when she came up out of the anesthesia, I told her.
Okay.
I didn't say you're going to die. I said you're seriously ill. You're
Critically ill.
And then she could put two and two together and make four, and she did. I mean, it was that fast.
Of course.
I don't think, it's my belief, I'm sure, but it is my belief. I don't think anybody deserves to go out of here without knowing it.
Huh.
And yet I don't think you should go rushing in, and the timing is so important.
So were you talking to her as a helper, therapist, or mother?
The mother.
Of course.
You know, when there's nothing else to do and all you can give is just to be there. We had watched Contact, the Carl Sagan's movie.
Yep.
And it went almost like that.
Yep.
But she didn't come back and say, you know.
How do you know? There was a great Christian mystic, a woman called Julian of Norwich, I think about the 14th century. She said, "Love is not changed by death, and nothing is lost, and all in the end is harvest."
And in the end...
All in the end is harvest.
Is...
Harvest, you know, the bringing in the...
Is how they...
Harvest. Harvest. I'm going to write it down. Where's my pen?
Spell it. It sounded like Harvard and Yale. Harvest.
Harvest.
Well, that's a strange
That's what I
word.
said. It's a poem.
That's a strange word to have at that particular point. I think I'll write a poem and make it differently.
Why don't you? Okay, I want to hear the first line.
My poem.
Yeah, off you go. Truly.
I love you. Godspeed. Thanks for the time. The journey was spectacular. Especially the challenges. I'm simply not in a poetic mood.
Your poem didn't even rhyme. I was waiting for the rhyme.
But harvest didn't do it. Okay.
Well, I got a shorter one for you.
Okay.
Woody Allen said, "I'm not afraid of death. I just don't want to be there when it happens."
Oh, amen.
Yeah.
It's not a pretty thing to watch.
No.
Unless you can, I mean, on the physical level, it's not. Otherwise it's very, very spiritual. But one of the Maharishis or whomever said that death is like taking off a tight shoe, and that it's perfectly safe. Did you know that? Thank you, David.
This is a kind of a natural place to pause, I think. But we could do a lot more here. I'm actually a little concerned about you as a person, not as a mother, but not as a therapist, as a person. And I think it would be very good for you to do some follow-up tapping
Oh, I think so.
Yeah,
Yes. I can do that.
sure. And have you got my email address?
And
My email address?
email.
Email? Please send me some emails.
I'll be glad to do that.
Okay. Now you wait here and we'll talk to the group, all right?
Okay. Thanks, people, so very much.
Oh, don't thank them. No, you're welcome. You haven't heard all the dumb questions yet. You can't say that. So do we have any feedback, comments, impure thoughts? There's a question.
It's actually not a question. It was more kind of a comment. I initially was starting, when you said to go ahead and tap along with, as you were working with at the very beginning, I thought you meant kind of to tap as a supporting role for her. And what I found that I was actually tapping half the time to support her, but the other half the time because I could feel myself kind of drawing into things, and it was allowing me to kind of actually stay present in the room without going into whatever upset that I might have going on. I'm going to be interested to see the next couple days how I'm feeling about some other issues, just because I figure I've been tapping on things not with the intent of clearing them, but I expect them to be clearing up just out of doing this. My mom died the day after my birthday, which will be, the anniversary will be coming up Saturday, so that's kind of why I'm going to be curious to see how the next couple days go.
What's your expectation about yourself?
Oh, my expectation now, I mean, I actually kind of really honor and my mother, because I discovered what a wonderful woman she was after she died. And not that I didn't think she was a good mom before, but I actually discovered where she affected people that I had never seen before. You know, I'd never seen how she touched other people's lives, and that was kind of she was an inspiration to me as a result of that. So I'm expecting to continue, actually to be even a little bit more lighter about May 24th than even normal. You know, I've not actually had any really horrible things or thoughts as a result of it because of how much I appreciate her, but I'm expecting even more stuff, lightness stuff, you know?
Yeah.
Kind of good stuff, you know?
Okay.
Yeah.
Thank you. Question?
My question is, this was a very intense session we were watching. How do you keep yourself so calm, and after you've done 1, 2, maybe 3 sessions like this, how do you clear your field so that you're not carrying around anything from the people you worked with? Are you just tapping yourself afterwards?
I hope you noticed I was doing a lot of tapping myself.
Mm-hmm.
The other answer to your question is I've had a hell of a lot of help in my life, and maybe it shows a little bit.
Okay. Great. Thank you.
Yeah. See, I'm getting all the credit for your hard work. That's a good system.
Be my guest.
I can't reach the microphone.
Okay, you say the question, I'll repeat it for everybody.
I would be interested in knowing what level of reconciliation or clearing that you feel from the time you started to where you are now.
The question is, how much reconciliation or clearing do you feel personally from the time you started until up to now? Is it like a little testing or checking? Yeah, why not?
I would say about 95%. Now, when I signed up, and I'm not sure how long ago that was, but when I heard about EFT and got the tapes and started, I knew there was something to this. And so as soon as I heard about this workshop, I signed up. So I think the work had started even then. But then, and my goal was to come in here and to leave clear, whatever that means. And I knew that I could do that here. I had a belief that I could. And then Stephen had mentioned Stephen Campbell had talked about David and Steve from Australia. And so I was cued to be watching for them. And then when I realized that you had specialized in the post-traumatic syndrome, that's where I want to go. That's where I need to go. And so from the time I went to him, the work really started then. I was like Old Faithful. And he tapped.
Leaking everywhere.
Everywhere. And he tapped and he tapped. And I've been walking the corridors in the rooms and tapping and crying. And I don't know whether anybody's noticed or not, but I have permission to weep whenever I need to weep.
Yeah, I think we've got a few left in here.
And then we spent about 15 minutes together. So it hasn't all happened right here, by the way. 5 minutes,
5
he's
minutes.
saying, yeah.
So you've been doing some tapping in advance of the session,
Yes.
and maybe getting
Yeah.
into it, yeah.
But the main thing was I came here not to avoid, because I've had so many months and weeks of, quote, having to hold myself together, having to be objective.
See that? That's the problem. Yeah.
Right.
And it started right in the ward where they said, don't cry. Yep.
Be
Yeah.
objective, be
Yeah.
there for whomever. Even though I'm separated from the people in Virginia, I'm still supposed to be, I guess, priest, therapist, superwoman, I guess.
I met one of them in Australia. She was lying horizontal.
I have a question. This didn't appear to me to be an actual traumatic experience. It seemed more to be grief, except in the reaction. Would this be what you would term a post-traumatic stress situation, or how would you define this as far as your clinical expertise?
Yes, good question. Strictly speaking, it's not post-traumatic stress syndrome, but this is one of the very wide and broad definitions that brings all of human experience into it, including childhood and grief and the tribulations of relationship. It's a very legitimate problem in as much as the feelings get frozen in your nervous emotional system and you cannot shift them. And sometimes it gets very, very heavy. Would you agree?
Again, my ear tubes are swollen.
I was just saying the problem got stuck in your system and you couldn't shift it.
Right, okay, yes.
So
Yes, I would agree with that.
that's my definition. Yeah, it's grief, but there's a lot of traumatic events in there. I didn't linger on the event itself. In Ree's system, she's so full of it, it's so chock-a-block. All you have to do is do a lot of tapping. No need to bring up the problem. And she's so responsive and so wanting to work. Last question.
I think you alluded to my question a little bit. What has been your emotional state since the death of your daughter? Like, she's been dead for 2 years. And did coming here allow you to release a lot of it and allow you to feel what you've been stuffing, or have you had occasional bouts of, massive sadness and...
Well, see, by the time we had the memorial service in Virginia and I came back to Florida, I had a Floridian memorial service because all of her childhood friends were there, her high school buddies. When that was finished, it was like everything went away. I mean, it was like I was the only one with a death.
Mm.
It was separated from
I got stuck.
the family in Virginia and by a divorce that had been in 1988. And so I knew that I was depressed. I felt quite subdued. I felt as though maybe I was walking through a lot of water. And it took about a year because everything was so explainable before the physicians caught up that my thyroid had blown out. So, being depressed, gaining weight, not being involved in the activities that I would normally enjoy, because my activities had been to build the stamina to be the caretaker for her. So you can imagine what happened to my walking or the tennis, or all motivation was gone. And I was looking, I knew to look for motivation, and I couldn't find it. And so I felt as though I just kind of survived.
Mm-hmm.
And Stephen called, and we started classes, teaching classes together. He would drive over from St. Augustine to Tampa, and that was extremely helpful. But I couldn't seem to catch on to, well, once again, the motivation has to come from a value system. It was like my values were wiped out again. And so I knew that I was not, quote, well, but I also knew that I was functional. I was going about my daily activities, I was making myself do. And I knew that I needed to do work, but again, where would I do it? Who would I do it with? Stephen and I belong.
A guy from Australia, of course.
To come to Australia.
So basically then, you weren't feeling a lot during that time.
I was
So
what?
that's why so much came up
She
here.
says you were healing a lot in that time. I don't think so.
No, I said she wasn't feeling a
Wasn't,
lot.
yes.
That
That's
was not
correct.
healing,
Okay.
no. And
Thank
see,
you.
I'm a member of the Society of Neurosomatics, which is an outgrowth of NLP, and through the computer and the email, that's how I managed. That community was extremely loving and reached out to me, but that's not a touch. That's not a wake up and, see your eyes. So,
I'm going to draw a line here because we've got to wind up
Okay.
at the time. Thank you for your question. We're going to meet back here at 13 minutes to. Could we have a round of applause for our volunteers? I think it would be very helpful to have an interactive session. We don't necessarily have to go up until 9:30, but I'd like to cover what I consider the highlights of treating post-traumatic stress. Really like to make it interactive though. I had a question from a shy person who didn't want to come up, so that's okay. I'll say what. Oh, you can come up. Good. Excellent.
I was just curious about the points of your tapping the finger and where on the wrist.
Yeah, you notice that I'm tapping the fingers and the hand and the combination point on the wrist a lot. There's several reasons for this. The first and most important reason is constant meridian stimulation. I don't particularly mind which meridians, which points. I don't think it matters at all. Who's that guy in Israel who does the palm therapy? I was fascinated. His book is over in the corner. He just uses points on the palm, as I understand it. Larry's original Be Set Free Fast was 3 points. Here, here, and little finger point. Why can't we just use a lot of stimulation and do our work as we're trained to do? The other reason I use the arm points is I like to give the client a bit of space, distance even. I'm a bit careful about intruding into their inner world. This is absolutely no reflection on the way Gary works. I think when Gary worked with me, it was an absolute revelation to experience Gary, but I don't work like that myself. I have a little bit more space, a bit more distance. And especially with difficult issues, I think that's a very wise idea. You can get caught out the other way. You might feel like tapping on somebody. They might not feel like you're tapping on them. I can assure you that happens quite a bit. I also had a question about can you do this kind of work with people that you're close to? And I thought that was quite a good question, so I'll bring it up here. Of course you can, but you have to be very, thoughtful about it. You're taking up an important position in their inner world, and if you're not prepared to go all the way and do all the work, I wouldn't even begin. Because there's nothing more frustrating to the person in need to have someone bail out halfway through, because either they can't handle it or you're both going to a place where you get lost. That's why it's extremely good to have a good assessment and to know as much as you can about the person you're helping with trauma. The more you know, the better off you'll be. Why head out down the expressway at 100 miles an hour if you don't know where you're going? Because that's what tapping can do sometimes. It's a very powerful thing. Any other questions before I amble and free associate through my 12-page handout? No questions? Okay. This is Gary's seminar, and I think the most important thing is to associate EFT with this kind of work. If you just take home the idea that in a very simple way you can use a focused technique in your own method, in your own style, and integrate a lot of meridian stimulation into what you're doing, I think you'll be quite successful. I was fascinated to see Gary doing double tapping and lots of the head point. I've been using double tapping for years. I've never seen Gary do it before. Maybe he was watching some of our videos. And I think it's extremely effective. And you know, you're halfway through the setup and off you go into the tapping. Of course. Pat. Yes, Pat.
Callahan started with the double tapping, as I remember, in 1986 and 87. And then he went all over the place. And I don't know what he's doing now, but that's the way I originally learned. And I had to unlearn it when I converted from a kind of technique I'd been using, which was a form of Callahan's, over to EFT. Then was the first time that I ever did the one side. But the top of the head, Gary brought in about, he was doing it 3 years ago. I remember him beginning to do it then.
Michael Gandy told us about that at San Francisco in '97.
Yeah.
Yeah.
Right.
Do you have any comments about this session or any questions?
No, I don't really have comments. I think it was moving. I think it was difficult. I think it was almost courageous to go, and I'm speaking now as a therapist, from a therapist standpoint, to go into what is such a tremendous picture and still be able to bring out of it something that was positive, really positive for her, even though you can't solve the big thing. And I think that's a challenge here, that there's several of us, for example, that take people out of the room when they're having real crises here. And it's been a challenge to help the person really get something, even when you know that this has got to be more work, and it should be probably, in many cases, work with somebody, with a professional. So I was I was really surprised at the amount of resolution that seemed to come from it.
And what did you think about the amount of focus I placed on the negative?
I thought it was not a great deal of focus on the negative. I thought it was a real balance between the two. And I felt it was a relief to her because people can go around those things and not really, she had that feeling. She should have gone first and not that child. And you laid it out, but you did it very gently. You really did it. You may not know it until you see the film, but you did it very gently. And that's why she accepted it. You didn't push it on her, but you let it be there, and she got it. So I felt that that was very, very important. It was a very important truth that was expressed. And then there was the intangible thing, which is the relationship and your caring. And it got across to her very strongly, I think. And she allowed, you could see her opening up and talking in a different way. And I think something did happen that was very, very critical here. So I was impressed and I learned. Thanks.
Thank you, Pat. Steve Wells and I like to work with the negative. We like to work with the dark side. It's not so scary. It's not so scary. It's what they're thinking and feeling anyway. And it is a tremendous relief for the person to know that someone else knows. And you can actually deal with it in almost a neutral fashion. You can, with tapping, you can actually get to the neutral position where you reconcile the opposites quite quickly. I personally think this is the direction that this kind of therapy is heading toward, where you reconcile opposites. And at that time you head into a place which is, it's peaceful, but it's actually full of a certain kind of love. John DeMartini works in this fashion. It takes him hours to reconcile all the opposites in a person's problem. But when they do reconcile them, when they do really feel each and get balanced, then they're at a different place. It's just incredible. But I think with tapping you can get there very, very quickly. This actually brings up what I think is the most important part of treating trauma, and that's the relational aspects of doing this work. If you, for one moment, lose this connection, rapport, it's a heart connection with the person you're working with. If you lose that for one moment, then you're in trouble. And they'll feel that you've lost it, and you'll have to get it back very quickly. Unfortunately, in my profession, it's quite common that not only do you not have the rapport in some of this work, but the re-experiencing of the trauma is re-traumatising. I mean, how useless is that? I've even done this myself. I feel really uneasy about some of the early work I did in trying to help people with trauma. The other issue that springs to mind when I think about this is a lot of people try and help themselves with this. What can I do to fix myself? What can I do to work through this? Often, the answer is very little. You need to work with someone. And then you need to help yourself after that. There is a bit of a movement in the EFT world to do it all yourself. I think that's a bit strange, considering that a lot of these blocks are unconscious. They're actually out of our awareness. How would we know? If you have a chance and you're working with someone with a traumatic event, it's extremely helpful to teach them EFT on a neutral subject before you dive into the deep end of the pool. So I usually pick a physical thing like aching or discomfort or body tension, and you train the person in EFT and how to do it. That introduces them to the relaxing effects of EFT and actually teaches them the very simple algorithm. So when it comes for the time for the hard work, they never have any doubts about the actual technique. And you can actually abandon the thoughts of being clever, forget about the technique, and just do all the work with the person, while in a kind of mechanical sense, you're just doing a lot of tapping. That's my preferred method. Very often with trauma, you're not seeing someone soon after the trauma, you're seeing them many, many years later. The trauma is quite fresh. In Australia, they have a t-shirt, it says, you're born, life's a bitch, and then you die. This is the Aussie description of traumatic stress. You know, the world is a tricky place. Who's read that book by Alice Miller, The Drama of Being a Child? Who's read that? Yeah, it's a fascinating book, full of examples of how, just in ordinary life, children are not validated or even understood, let alone accepted by their parents. We all do this. We all do this. And we can't know what that does to the inner world of the little person. It's usually quite difficult, quite traumatic. These beliefs are way outside awareness and even consciousness, but they're around somewhere when you do the tapping and you come to them. I was very aware that there are a lot of these issues with Ree when we were working, but they don't actually need to be talked about. If they're there, you can work with them, and you might find out later on, or you might not. And I hope it was clear that I wasn't in any hurry to achieve anything here. What's the rush? What's the rush? Sometimes there's a pressure with EFT because it's so incredibly effective. The pressure is to do. It's only a technique, it's only a tool. What about just being with and doing a whole lot of tapping and see what happens? Knowing EFT has given me a lot more confidence just to be with the person and just to see what happens. And you get a lot of surprises. Sometimes issues like this can resolve very, very quickly because they're not the issue you thought it was. Sometimes they're unresolvable, but that's okay. You can't answer everything. And it is a body work. You're working in the body. Who else here likes or uses the idea of continual tapping? Anyone? Well, I actually think Gary's right into it now. He hardly ever stops. Isn't it great? Why should you stop? It's only the mind that wants to think about what was said and do a bit of processing and you know, points, levers, whatever. Why not keep tapping? Why not let the processing keep going? I think it's very important. I have a dream that in my futuristic tapping clinic, the person comes in and lies down and teams of 8 or 10 people tap on every point they can find. Why do you just have a bit of a chat and an hour later it's all over? Who's familiar with the tearless trauma technique? Everybody read that on Gary's website? Great idea about tearless trauma. The idea of treating a trauma from 1 or 2 or 3 steps backward in your inner world. You don't go to the trauma, you actually imagine what the intensity would be and treat that imaginary figure and then do repeated sequences until the imaginary figure is very, very low. Then when it's really low, maybe 1, you actually go to the real thing and see what happens. In theory, you're ready to work at that point with the real thing. I have found that in groups that can be a little bit tricky. So I'm very happy to do it in groups as long as there's people around to treat the people that can go to a 10 immediately the minute even they do it from 3 steps back. But generally speaking, it's a great way of approaching a problem. And there were elements of that in my session here with Ree, working from 1 or 2 or 3 steps backward, also coming into the problem and then coming out again, contact, withdrawal, just a symbolic way of working without overwhelming the person. There are sort of waves of the intensity and the waves go up and down. I hope you noticed in the session there were a lot of metaphors that reused. She was really switching back and forth many times between the role of a mother and a helper/therapist. We all do this. But what's the real role here? It's really the mother. And then there's the person. A lot of mothers never get round to their own needs until the kids have grown up. And actually, it reminds me of that really funny cartoon. I used to have it in my office, a pair of 90-year-old parents huddled around the divorce counsellor's table. And the counsellor says, "Why do you want to get divorced now?" I said, "Well, we just wanted to wait till all the children had passed away." Gary talks a lot about guessing, talks a lot about intuition. I've made so many mistakes in my life by trusting my thoughts. I don't do that anymore. It always leads me astray. I trust my intuition. I've made some mistakes, but they haven't been nearly as bad as the ones I've made with this. So if your intuition, if your instinct, if you're guessing, if your gut tells you that this is an issue or this is useful and helpful, go there. Go there in this kind of work. I recommend it. Who's read Gary's article on his website about treating children with EFT at night? A little, yeah, isn't it lovely? A little routine for children. They're lying in bed and it's night time and they've had their dinner and their bath and maybe their story or whatever, and they're just going through what happened in the day while mum or dad is just tapping on the points. And children are so quick. So they're actually letting it all go. They're actually releasing it before they go off to sleep. Wouldn't that be a great way to go to sleep every night? So it's a kind of very loving thing. The parent is tapping on the points while the child falls asleep. I can't think of anything better. As Steve Wells, my colleague, says, always treat yourself before you treat your child for any kind of real or imaginary trauma. Treat yourself, your own anxiety, for their getting better. We're always far more concerned about what happened than sometimes we need to be. A lot of blocking beliefs pop up in this kind of work. I think most people here are familiar with that idea. It's just another problem, just another difficulty. Sometimes you can put it into words, sometimes you can't. But it absolutely fills up the person's system and everything about them reflects and manifests this. So you actually perceive it even if you don't know what it is. If you see someone you love coming toward you, you can tell from 100 yards away how they are. You can. And even on the phone, the slightest little thing, it's always like, what's wrong? You can tell. So you need to develop that sensitivity to focus in on the client or the person you're helping. And if you develop that very acutely, you'll be doing such good work because you'll be fully aware of something even if you don't know what it is. In medicine, we were trained to actually find out what was normal. And then if we found something that wasn't normal, we'd be alert. I always remember we were taken into as students to the bed of a lady who was very, very sick. Well, we were just taken into the bed, and the big boss said, I want your diagnosis when we come back out of the room. So we all got to have a look and think, and we all went into another little room. He went through the group of 7 of us, and none of us had a clue what was happening. Of course, we're only young students. And he said, well, is she sick or is she well? Oh, she's sick. He says, how do you know? Excellent question, because we knew. We knew the moment we walked in. But it took him to drag out of us what we had seen in an instant. And there's a lot of that in this kind of work. And the mind gets in the way, it really does. So you use that intuition and go with it. It's Larry Nims taught me that it's universally true that when people have a problem, after a while they get very cranky with themselves for having it. I should have handled this better. I shouldn't have had it in the first place. Actually, that part of it can be bigger than the original problem. It's huge. So we talked a little bit about being a bad mother. That's universally true for every mother. What can you say? If it isn't, I'm just thinking of the biggest problem for the average woman. It's not the husband, it's like the guilt about your own mother or whether your mothering is good enough. It's just huge. A lot of men don't feel much guilt. I felt some about 72, but it passed pretty quickly. But I understand that a lot of women feel it a lot. So what's the consensus in the room? Who agrees that women feel a lot more guilt than men? Whoa. Who thinks that's not true? No hands. All right. So women have a monopoly on this. I don't know why. Do you know why? No.
Because we've been taught that we're the main.
Our experience is that we're the major caretakers of children, and so if anything goes wrong, it must be our fault. We didn't have a good relationship with our husband, we worked too hard, we weren't there, we did, so guilt and blame.
There's that groaning. Thank you. I'd just like to say a little bit about forgiveness because it's a complex topic and very much misunderstood. Hi, Gary. Gary says true forgiveness is the aim of all healing, and of course it's a spiritual question. I think of Gary as forgiveness in action. Sorry, I had to bring you in, Gary. But not everybody has that facility. Not everybody is connected. A lot of people want the spiritual bypass. I forgive you. What a load of rubbish. There is so much to do before you get to that point, so much anger and resentment and frustration and difficulty. Go ahead. Can you put Gary on?
Hold on. Forgiveness is interesting because there's 2 definitions of it as far as I can tell.
Yeah.
One of them is a definition that's, let's say I come and I kick you in the shins.
Yep.
Or better, you come and kick me in the shins. And I go, oh, that hurts. I don't like you anymore. And I'm mad at you and so on. Why did you do that? And I'm not in a very forgiving mood. But later on, things mellow. And I say to myself, well, I'll go make friends with Dave. And so I say, Dave, I forgive you. Okay? And which means we can be friends, we can walk and we can talk and so on, But have I really forgiven? That's what's interesting. Have I really forgiven, or am I going to keep it in the back in my little quiver of arrows and things and keeping score? And the next time you do that, I'm going to bring it up. Okay? So the practical way of forgiveness in this separated world is to do what I said. We say we forgive, but we keep score. Okay? in my view, and this is the Course in Miracles view too, the true nature of forgiveness is actually and literally something we cannot do in this state, and that's to forget like it never, ever happened.
Yeah.
And that's where the true peace comes in. When you're keeping score, it's not true peace, and it's not true forgiveness. That's how we practice it here.
Yeah. Thank you, Gary. I'm going to wind up a little bit early, and I just want to say, unless we have more questions, because it's been a long day. I mean, haven't the other presentations been excellent? Yeah. Before I came on, I really felt like changing my name to Steve. To be consistent, you know. I want to put in my 2 cents worth about depression. Now, I'm going to use up all the credit I've engendered in this whole 3 hours because I have something to say that some of you may not agree with. In my own experience, with an open mind, treating all the people that come to me with depression, and boy, is that a part of post-traumatic stress, I find personally, regardless of the cause, when someone has moderate to severe depression, that I can't really get any good work done with them, including the energy therapies, until that depression is treated and that depression lifts. Now, the only way I know how to do that is to use an antidepressant that works. And that's what I do. Now, this might not go down too well with a lot of people that think, well, let's treat the depression properly with this method or that method, or you name the method, I'm open to it. I've looked at everything, but I can't get those methods to work, and I don't know any other way to do this currently. I no longer try and help people with moderate to severe depression unless that depression is treated effectively. It is just too difficult and too humiliating and traumatizing. Go ahead, Pat.
I absolutely agree, and I'm so glad to hear you say that. I have refused 3 people recently to treat them because they had really quite severe depression, and
Yep.
they had done nothing about the antidepressants. And I have maybe 1/3 of the people that I treat who are depressed, or who 1/3 of the people I treat almost are on antidepressants for a while. And the facilitation of the EFT and the whole treatment is tremendous.
Yep.
It's just a myth that they should be, that every bit of work you do should be allowed to be washed away the way waves come in and wash a sandcastle away, is what happens when you don't have that support.
That's
so I'm
right.
so glad to hear you say that.
I had many, many years of working with people with moderate to severe depression where the very next day it was all gone.
That's right.
It's so humiliating for that client. Anyway, if anybody knows a method to treat, heal and cure moderate to severe depression, please let me know right away. I'm deadly serious. Mild to moderate depression, that is different. That is completely different. Do everything you know how to do. But for the time being, I'm using a good modern antidepressant. Very few side effects, but I'm not going to talk about that. I'm talking about people getting better. That's where I'm at currently. Deborah. Oh, I'm sorry. Yes, Kathy.
You've heard from the therapists. You ought to hear from a patient.
Go ahead.
I had the depression and euphoria swing thing going on. And when I was normal, I could do all of the positive thinking and the creative visualization. And then when the depression hit, it was gone. I couldn't do any of those things. And yeah, it's kind of upsetting to take a little pill and be a normal person again. And yeah, I would probably have preferred to have, visualized myself to pure health. But that is not what happened. I have a little pill that I used to take every day, and it made me a normal person. It made me open to these things. I've been doing EFT on myself for a year. I don't have to take the little pill anymore, but I have a bottle of them at home, and just in case. My husband says, maybe you should take your pill. It really does help. It is not the horrible, awful, wicked, evil thing that so many people think it is. It can help.
Thank you. Deborah.
I certainly have no objection to antidepressants. Before I learned the newer methods, I was trained classically. I was trained in the Baltimore Washington Institute for Psychoanalysis, and I did very conventional Freudian psychotherapy for a lot of years, and I certainly was trained in the medical model, and most of my, at that time I called them patients. I don't call them patients anymore because I don't think medical model at all. But at that time, patients were seen by psychiatrists before they came to me. I'm not an MD. And I think most patients were on antidepressants or other medications. And I currently have no objection to them. But I have found since I started using these methods that most people who come to me on antidepressants want to get off them very soon after being with me. My first introduction to these methods was traumatic incident reduction. And I worked with one person who had been on antidepressants for close to 30 years. He had many traumas and came to me for, I don't know if it was 4 or 5 days, a block of time. He was from out of state. And we worked 4 to 6 to 8 hours a day, depending on our energy levels, using not only traumatic incident reduction, but other forms of metapsychology. And at the end of that period of time, he wanted to just stop the medication. I advised him not to, that he needed to titrate down and see his doctor, which I don't think he did, but he was finished with it. And then when I learned EFT, I found the same thing. People came on medications, and I never discouraged that, but I find that people get off them very quickly. So I think I'm a bit more conflicted about it from what you just said.
It's crucial to work out the level of depression.
Yeah, this is true. And I rent space at a psychiatric hospital and am often called to go onto, well, I used to be called to go onto the units to work with severely depressed people, and found that the EFT or other methods like this were helpful. But you're right, you have to figure out what that level is. I experience myself as having worked with some of the most severely depressed people. So I just have a little bit of an inner conflict with that from my experience, yet I wouldn't discourage anyone from taking medicine.
Well, I'm open to any method that will, improve and increase the cure and healing rate. I'm just saying where I'm at right now. I'm sure things will change. Thank you for that. All right.